afternoon, everyone. Welcome to Little Master series of Physio TV. I, Dr. Divya Sodrani, resident of Community Physiotherapy from Sancheti College of Physiotherapy, welcome you for today's session. Today's topic is Berg Balance Scale. Objective will be at the end of the session, audience will be able to understand Berg Balance Scale as an outcome measure and its interpretation. Introduction. The Berg Balance Scale BBS is used to objectively determine a patient's ability or inability to safely balance during a series of predetermined tasks. It is a 14-item list with each item consisting of a 5-point ordinal scale ranging from 0 to 4. 0 indicates the lowest level of function and 4 indicates the highest level of function. It takes approximately 20 minutes to complete the scale. It does not include the assessment of gait. Intra-rater reliability is 0.97 to 0.99 and inter-rater reliability is 0.96 to 0.98. So the intended population in which the Berg balance scale can be used is patients with balance impairments, elderly population, patients with acute stroke. The equipment required for the same will be a ruler, 2 standard chairs, one with armrest and one without armrest, a footstool or a stepper, 15-feet walkway, stopwatch or wristwatch to calculate the time. The interpretation of the scale will be the highest amount of score is 56 and 41 to 56 indicate low fall risk, 21 to 40 indicate medium fall risk and 0 to 20 indicate high fall risk. So we'll start with the components. The first component is sitting to standing. So the instructions for the same will be, please stand up, try not to use your hand for support. The scoring goes like 4 is able to stand without using hands and stabilize independently. 3 able to stand independently using hands and 2 able to stand using hands after several supports. 1 needs minimal aid to stand or stabilize. 0 needs moderate or maximal assist to stand. Next component is standing unsupported. Instructions will be, please stand for 2 minutes without holding on. So the scoring goes 4 able to stand safely for 2 minutes, 3 able to stand 2 minutes with supervision, 2 able to stand 30 seconds unsupported, 1 needs several tries to stand 30 seconds unsupported, 0 unable to stand for 30 seconds unsupported. Next is sitting with back unsupported but feet supported on the floor or on a stool. Instructions for the patient or client will be, please sit with arms folded for 2 minutes. The scoring goes 4 is able to sit safely and securely for 2 minutes. 3 able to sit 2 minutes under supervision. 2 able to sit for 30 seconds. 1 able to sit for 10 seconds. 0 unable to sit without support even for 10 seconds. Next is standing to sitting. Instructions will be, please sit down. The scoring will be 4, sit safely with minimal use of hands. 3, controls descent of using hands. 2, uses back of legs against chair to control the descent. 1, sits independently but has uncontrolled descent. 0, needs assist to sit. So next component is transfers. So the instructions for this will go, so the chairs will be arranged for pivot transfer. Ask the subject to transfer one way towards a seat with armrest and one way towards a seat without armrest. You may use 2 chairs, one with and one without armrest, or you can use a bed and a chair alternative. The scoring goes 4 able to transfer safely with minor use of hands, 3 able to transfer safely definite use of hands, 2 able to transfer with verbal cueing or supervision, 1 needs one person for assistance, and 0 will be needs two people to assist or supervise for safety. Next component is standing unsupported with eyes closed. So the instructions goes, please close your eyes and stand still for 10 seconds. The scoring goes 4, able to stand 10 seconds safely. 3, able to stand 10 seconds with supervision. 2, able to stand 3 seconds. 1, unable to keep eyes closed 3 seconds but stays safely. 0 is needs help to keep from falling. Next component is standing unsupported with feet together. Instructions will be place your feet together and stand without holding on. Scoring will be 4, able to place feet together independently and stand for 1 minute safely. 3, able to place feet together independently, stand 1 minute with supervision. 2, able to place feet together independently but unable to hold for 30 seconds. 1 will be needs help to attain the position but able to stand 15 seconds feet together. 0 will be needs help to attain the position and unable to hold for even for 15 seconds. Next is reaching forward with outstretched arm while standing. The instructions will be lift your arm to 90 degrees, stretch out your fingers and reach forward as far as you can. The examiner places a ruler at the end of fingertips when arm is at 90 degrees. Finger should not touch the ruler while reaching forward. The recorded measure is the distance forward that the fingers reach while the subject is in the most forward lean position. When possible, ask the subject to use both arms when reaching to avoid the rotation of trunk. So the scoring for the same goes 4 can reach forward confidently 25 centimeter that is 10 inches. 3 can reach forward 12 centimeter that is 5 inches. 2 can reach forward 5 centimeter that is 2 inches. 1 reaches forward but needs supervision for the same. 0 loses balance while trying or requires an external support. Next is pick up object from the floor from a standing position. The instructions for the same goes pick up the shoe, slipper or an object which is placed in front of your feet. The grading will be 4, able to pick up the slipper or any object safely and easily. 3, able to pick up the object but needs supervision for the same. 2, unable to pick up but reaches 2 to 5 centimeter or that is 1 to 2 inches from object and keeps balance independently. 1 is unable to pick up and needs supervision while trying. 0, unable to try or needs assist to keep from losing balance or falling. Next is turning to look behind over left and right shoulders while standing. Instructions goes turn to look directly behind you over towards the left shoulder and repeat to the right. Examiner may pick an object to look at directly behind the subject to encourage a better twister. The grading will be 4, looks behind from both sides and weight shifts well. 3, looks behind one side only, other side shows less weight shift. 2, turns sideways only but maintains balance. 1, needs supervision when turning. 0, needs assist to keep from losing balance or falling. Next is turn 360 degrees. The instructions will be turn completely around in a full circle, pause, then turn a full circle in the other direction. 4 will be able to turn 360 degrees safely in 4 seconds or less. 3 able to turn 360 degrees safely one side only 4 seconds or less. 2 able to turn 360 degrees safely but slowly. 1 needs close supervision or verbal cueing. 0 needs assistance while turning. Next component will be place alternate foot on step or stool while standing unsupported. The instruction goes place each foot alternately on step or stool. Continue until each foot has touched the step or stool 4 times. So the grading goes 4, able to stand independently and safely and complete 8 steps in 20 seconds. 3, able to stand independently and complete 8 steps in greater than 20 seconds. 2. Able to complete 4 steps without aid with supervision. 1. Able to complete more than 2 steps but needs minimal assist. 0. Needs assistance to keep from falling or is unable to try. Next is standing unsupported, 1 foot in front. Instructions will be, so for this, the examiner should demonstrate to the subject or patient or client. So the instructions will be place 1 foot directly in front of the other. If you feel that you cannot place your foot directly in front, try to step far enough ahead that the heel of your forward foot is ahead of the toes of the other foot. To score 3 points, the length of step should exceed the length of other foot and the width of the stance should approximate the subject's normal stride width. So the grading for the same will be 4. Able to place foot tandem independently and hold for 30 seconds. 3. Able to place foot ahead independently and hold for 30 seconds. 2. Able to take small step independently and hold for 30 seconds. 1. Needs help to step but can hold for 15 seconds. 0 is loses balance while stepping or standing. Next component is standing on one leg. The instructions will be stand on one leg as long as you can without holding on. Scoring will be 4. Able to lift leg independently and hold for greater than 10 seconds. 3. Able to lift leg independently and hold 5 to 10 seconds. 2. Able to lift leg independently and hold for more than or equals to 3 seconds. 1. Tries to lift leg but unable to hold for 3 seconds but remains standing independently. 0 will be unable to try will be unable to try or needs any assistance to prevent from falling. Thank you.